have cinnamon on my face all the time. Hey guys, it's Natalia and welcome back. For today's video, I am finally answering the Instagram poll that I put up a couple weeks ago with oral hygiene and dental hygiene questions. For those of you who are new or if you just live under a rock, I have been a registered dental hygienist for about 2.5 years at this point, which means I went to school and had to take a national board exam in order to get my license, which means that I am qualified to answer these questions. So the first question that I asked was, all adults have 32 teeth before getting any removed? And 61% said yes and 39% said no. So the answer to this question is no. All adults do not have 32 teeth. Not everyone has wisdom teeth. Some people have 2. It really just depends on your body and how many they created. But also, not even all adults have the 28 permanent teeth. Some people have missing permanent teeth. So, that was kind of a trick question. Not all adults have the same number of teeth. The next question was, some people have extra bone in their mouths. And 88% said yes and 12% said no. And this is actually true. Yes, some people do have extra bone in their mouths, and it can basically be found all over. Like in the floor of your mouth, on the outside of these teeth, on the outside of your upper teeth, on the roof of your mouth. I personally do not have any extra bone in my mouth, so I did not know it was possible, but yes, it is. Alright, for the next question, I asked, healthy gums are more pink or red, and 78% said pink and 22% said red. And the answer is pink. If they are red from bacteria, which means you need to brush your teeth a little bit better and start flossing. Flossing regularly makes gums tighter around teeth. Yes or no? 81% said yes and 19% said no, and the answer is yes. In order to support the tooth, we want a healthy bone level and we want healthy gums to be nice and tight around the teeth to help support them. People who do not floss regularly or brush hardly, their gums are like this and swollen around the tooth and literally flap. So we want the gums nice and tight. That is why it's very important to get the plaque out from the side of the tooth and under the gums. Gingivitis, bleeding gums, is the first stage of periodontal disease. Yes or no? 74% said yes and 26% said no. And yes, that is true. Gingivitis is the first stage of periodontal disease, so I would recommend flossing. Gingivitis, bleeding gums, is reversible. Yes or no? 86% said yes and 14% said no. And the correct answer is yes, which leads me into the next question, which is gingivitis, bleeding gums, is reversible within 4 weeks or 2 weeks. 80% said 4 weeks, 20% said 2 weeks. It's actually, I think, between 7 to 10 days. So within, like, right under 2 weeks, if you floss daily, you will be able to clear up the bleeding and the bleeding will actually stop. Bleeding gums are not healthy gums. Periodontal disease, which is classified by bone loss, is caused by a bacteria. Yes or no? 89% said yes and 11% said no, and yes, that is true. By flossing, you are clearing out the bacteria so that it does not have a chance to colonize and affect the bone. Smoking can cause gums to bleed less. Yes or no? 20% said yes 80% said no, and the answer to this is yes. Smoking will restrict the amount of blood flow into the mouth, which causes less bleeding, but it does not mean that it is healthy in this case. Smoking can cause bone loss, yes or no. 95% said yes and 5% said no. And yes, that was a true statement. A dry mouth can result in getting more cavities, yes or no. 74% said yes and 26% said no. And the answer to this question is yes. People with dry mouths are more prone to getting cavities. Dry mouth can be caused by a couple of things. It can be caused by smoking weed. It can be caused by people who take a lot of medications. Medications side effect is dry mouth a lot of the times. And people who breathe through their mouths a lot also dry out the tissue as well. So, multiple ways to fall into that category. How often should you change your toothbrush? Every 6 months or every 3 months? 22% said 6 months and 78% said 3 months. And yes, the answer is you should change your toothbrush or toothbrush head every 3 months. But this leads me into the next question. Should you change your toothbrush after being sick? Yes or no? 92% said yes and 8% said no. Yes, if you are sick, you should change your toothbrush after the sickness is over, which means you might have to change it out earlier than the 3-month window. And I think this leads me to the last question, which was regular dental cleaning appointments should be every 3 months or 6 months. 19% said 3 months and 81% said 6 months. So this was kind of like a trick question, but that's why I put regular dental cleanings. For people who do not have periodontal disease, you should go to the dentist twice a year, every 6 months. If you do have periodontal disease, then you need to go more frequently to make sure things are not getting out of hand. So people who have periodontal disease should be going every 3 months. So that final question wraps up this video. Thank you guys, everyone who answered my poll on Instagram. If you found this video interesting, make sure to give it a big thumbs up. If you have not subscribed already, make sure you click the subscribe button down below and also turn on your post notification bell so that you can be notified when I upload a new video. Thank you guys so much for watching, and I will see you guys in the next video. Bye! Hello.
¿Qué pasó, mi niño?
I'm making a video right now.
Oh, are you? I called you because I don't know what to do about this. I want to try to buy the sneakers in the morning, but I don't know what website it is and stuff like that.
I told you to go on the YeezySupply.com, but I don't know what time they release at.
I know, that's the problem. Does it tell you? How do you ever find out?
I don't know. For the ones that released today, they sent out an email, but I don't know. I'm gonna pull it up on my laptop also, I guess tomorrow if we figure out what time.
Okay.
So I can try to get them. I was gonna try to get the ones today, but I was sleeping.
I know.
And
why were you sleeping?
Because I was tired.
All day long?
They don't release all day long. They release at 10 o'clock.
Yeah, what were you so tired from? You slept for like 14 hours.
How did I sleep for 14 hours?
What time did you go to bed last night?
I don't even know.
10:30, 11